HIV, AIDS. As I shared at the beginning of the chapter, I didn't know a lot about the human immunodeficiency virus, HIV, before learning Magic Johnson was HIV positive, another way of saying that he had HIV. Now it feels like I can't remember a time before HIV or the acquired immune deficiency syndrome, AIDS, the final stage of the HIV infection. As AIDS is the advanced form of HIV, I'll refer to HIV AIDS in most of this section to describe the disease. An estimated 35 million people are living with HIV AIDS around the world. That's about the population of Canada. Since the first cases were reported in 1981, HIV AIDS has claimed the lives of even more people worldwide. 39 million, and sadly, counting. In the US, more than 650,000 people with HIV AIDS have died, and currently, more than 1.2 million people are living with the disease. HIV AIDS is on every continent, but it has hit Africa the hardest, where it currently is the number one cause of death in adults. Unquestionably, HIV/AIDS is the cruelest new virus of the past few decades, measured by the number of lives it has taken and the lives affected, particularly the millions of children it has orphaned. Thankfully, antiviral medicines now exist that enable people with HIV/AIDS to live healthy, full lives. These medicines work by stopping the virus from replicating or making more copies of itself inside an HIV positive person's cells. In 2015, with the right treatment started early enough, an HIV positive person can have a reasonable expectation of living an otherwise healthy life. The number of new HIV cases is going down as prevention and treatment efforts become more widespread and effective. At the end of 2013, almost 13 million HIV positive people were on antiviral treatment around the world. The vast majority, 11.7 million, in developing countries. The Clinton Health Access Initiative has helped expand HIV/AIDS treatment by working with drug companies to dramatically lower the cost of treatment so that more people can get the medicines they need. What used to cost thousands of dollars per person per year now costs $100 to $200 per adult each year, and even less for children. Because treatments cost so much less, developing countries and donor countries like the US, which is the number one donor to HIV/AIDS treatment efforts in the world, are able to purchase more medicine to help more people. Someone today who's receiving the less expensive and just as effective treatment is a boy named Basil. When I first met him in Cambodia in 2013, Basil was an almost 7-year-old full of energy who showed me, or more accurately, ran me, proudly around his school, playground, and clinic at New Hope for Cambodian Children, a residential facility for orphans and abandoned children living with HIV/AIDS. He didn't look sick at all, but when Basil was just a month old, he was left at a health clinic. He was very, very sick with tuberculosis, discussed in the next chapter. His mom had just died of HIV/AIDS, and he was HIV positive. That day, no one thought he'd live such a healthy life. No one thought he'd be alive at all for much longer. Basil became the youngest HIV positive child in Cambodia at the time to receive treatment, and now, 9 years later, he is healthy and still running around. We've made progress as a global community against HIV/AIDS, but still have a long way to go before every HIV positive person is getting the medicines needed and has a story like Magic Johnson's or Basil's, in which HIV/AIDS is a chronic disease to be managed, not a death sentence. HIV/AIDS is different from viruses like smallpox or measles because it attacks the body's immune system and it never quits. Our immune system keeps our bodies healthy by fighting off every infection that comes our way, like measles or pneumonia. Under the onslaught of HIV/AIDS, our immune system stops working. A common cold could prove deadly to someone with untreated HIV/AIDS. Without treatment, HIV/AIDS is almost always fatal. HIV is transmitted from person to person through the sharing of blood or other bodily fluids, often through sex. Another common way it can be transmitted is by so-called dirty needles, or needles that have been used before by someone with HIV/AIDS. If a hospital, for example, uses a needle to draw blood from an HIV/AIDS patient, and then uses the same needle to draw blood from someone who doesn't have HIV/AIDS, that person faces a major risk of getting HIV/AIDS from the used needle. Don't worry using new, sterile, a fancy word for super clean, safe needles is a required practice in the United States and around the world for hospitals, clinics, and doctors' offices. Another way doctors and nurses protect patients and themselves from HIV/AIDS is by wearing proper protection when they come into contact with blood. It's one of the reasons you've probably noticed the latex gloves your doctor or nurse wears when drawing blood or giving you a shot. While needles can pass HIV/AIDS, mosquitoes thankfully cannot. Tragically, mothers with HIV/AIDS can pass the virus to the babies growing in their bellies. This is called mother-to-child transmission, and it is the most common way in which kids have been infected with HIV/AIDS around the world. To protect babies born to mothers with HIV/AIDS, infected women must take antiviral drugs while pregnant. Children cannot get HIV/AIDS from hugging their moms or being hugged by them. You cannot get HIV/AIDS from touching or holding hands with someone who has HIV/AIDS. You cannot get HIV/AIDS from touching something that someone with HIV/AIDS touched. Currently, no HIV/AIDS vaccine exists. Generally, vaccines are developed from dead or weakened viruses, and those research efforts are often helped by studying people who've recovered from the disease. Unfortunately, thus far, no one has a record of long-term recovery from HIV/AIDS, though there are a few long-term non-progressors, people who have HIV and remain healthy without taking medicines. The common methods for developing vaccines have proven too dangerous or ineffective. Even with these challenges, there are many people around the world who are working tirelessly on an HIV/AIDS vaccine. The way people look, whether they're boys or girls, what religion they practice, where they live, and who they love, does not offer special protection from HIV/AIDS. You cannot tell if people have HIV/AIDS from looking at them, unlike some other illnesses that have obvious characteristics like rashes or sores. Someone's HIV/AIDS status can only be known through an HIV/AIDS test. If people don't know their status, they can't start the treatment their bodies need. It's estimated that millions of people worldwide, including hundreds of thousands in the United States, don't know their HIV status. In many communities around the world, including across the US, confidential and free HIV/AIDS testing is available. Confidential means only the person getting tested knows the results. If you know people who have questions about their HIV/AIDS status, please encourage them to get tested. Anyone can visit AIDS.gov to find a local clinic that offers free, confidential HIV/AIDS tests. If you have questions about how people protect themselves from HIV/AIDS during sex or in any situation, please talk to your parents, teacher, doctor, school nurse, or another trusted adult. The quicker someone is tested, the quicker treatment can start if found HIV positive. That's good for that person's health and for all of us. Someone who is on antiviral treatment is less likely to pass on the HIV virus to another person. It's especially important to be educated about HIV/AIDS so you can help teach others about how it is transmitted and how it isn't. Why? Well, in addition to helping people know how to protect themselves from HIV/AIDS, it's also important because, sadly, in many places, people are still discriminated against because they or someone they love has HIV/AIDS. In some countries, discrimination against an HIV positive person is still legal. Around the world, fear of stigma remains a key reason why people are reluctant to get tested and even to take the antiviral therapies that would help them lead healthier and longer lives. Part of treating people with respect and dignity, regardless of their HIV/AIDS status, is ensuring that no one feels any shame for being HIV positive or worried about getting tested. It's also standing up for kids who are bullied because they or someone in their family has HIV/AIDS. This is something we can all do. One way you can help kids like Basil, and adults too, in the developing world with HIV/AIDS or tuberculosis or malaria discussed in the next chapter is by supporting organizations like UNITAID and the Global Fund to Fight AIDS, tuberculosis, and malaria. Both are working to get people in developing countries the medicines and care they need to lead healthy and long lives, and to prevent people from getting sick in the first place. You may already be supporting UNITAID if you've ever taken a flight out of Cameroon, Chile, Republic of Congo, France, Madagascar, Mali, Mauritius, Niger, or South Korea. How? Well, those countries each decided to put a small levy, or tax, on airline tickets. Generally, it's $1 or €1. The euro is the currency in much of Europe for an economy flight ticket. Over time, that adds up. From 2006 to 2014, UNITAID raised almost $1.5 billion from airline taxes alone. To learn more about UNITAID's work, please visit unitaid.org. If you've ever bought a red product, you're already supporting the Global Fund. There have been red Gap shirts, Apple computers, and feed bags. Often, but not always, red products are literally the color red. Companies who sell red products contribute a portion of the proceeds to the Global Fund, specifically to support their efforts to protect babies from getting HIV/AIDS from their mothers. From 2006 to 2014, companies participating in red contributed more than $275 million to the Global Fund because of the purchases individuals like you and your parents, and possibly actually you and your parents, made. You can find out more about the Global Fund and RED by visiting theglobalfund.org. Unlike UNITAID's funding, most of the Global Fund's support comes from donor governments. So, if you believe in its mission and its work once you've learned more, urge your senators, congressperson, and our president to continue U.S. support for the Global Fund.